Now, today is the World Sight Day, a global call to love your eyes and ensure vision care is accessible, affordable, and available for everyone. In Nigeria, an estimated 24 million people live with some form of sight defect, with 84% of blindness due to preventable causes like uncorrected cataracts or refractive errors. Even though Nigeria launched the National Eye Health Guidelines to strengthen eye care access, huge gaps remain, especially in rural areas with the limited specialist services. On this day, the message is clear. We must prioritize eye health by raising awareness, expanding screenings, training more eye care professionals, and integrating vision services into primary health care.
Well, now how can Nigeria act to prevent blindness? And what do citizens need to do to care for their eyes better? To answer these questions and to shed more light on the significance of the day, we're joined in the studio by Dr. Anderson Chemeziri, who is the president of the Nigerian Optometric Association. Doctor, good morning and a warm welcome to Daybreak.
Good morning, and thank you for having me.
It's a pleasure to be here having this conversation, and of course we're all wondering, how can we improve access to eye care for average Nigerians on this World Sight Day? What do the statistics also say about accessibility to this type of care?
Yeah, World Sight Day this year, the theme is Love Your Eyes, and sub-theme is Vision for Everyone. And we know that the WHO, through the International Agency for the Prevention of Blindness, have been mounting a campaign leveraging on the WHO universal health coverage to make sure that there is vision for everyone. And we professionals at every level are doing everything to make sure that we carry eye care services delivery to the underserved communities and everywhere, especially to the vulnerable populations. As mentioned, one of the two major causes of visual impairment remains cataract and, of course, refractive error. And from latest studies, about 71 million Nigerians are suffering from one form of visual impairment or the other due to refractive error. That's a very huge number. And I think a lot needs to be done. And that is why we're here to see how we can, through digital technology, through devices, and through innovations, reach out to areas that naturally, normally you couldn't reach them, because there are a lot of people that are having this problem, and the population is densely in the rural areas.
Okay, I'll bring this matter to a vicarious level. I remember when I was at a former, sometimes early 2000, former place of work, and we noticed that many of the drivers were having accidents, and suddenly someone suggested to the Director General that they should do an eye test for the drivers, and it was discovered that many of them failed the eye test, and they had to recommend some glasses. So to address this at an early stage, what should be the kind of intervention? Do we need a public-private partnership? What kind of strategic intervention do we need? Because this is a very serious case. We have a lot of people driving. We have a lot of people handling very strategic positions. So with 24 million having one form of eye defect or the other, it calls for a crucial and urgent intervention. Don't you think so?
Yeah, quite. At our level, at the Nigerian Optometric Association, some years ago, we've done, during this World Sight Day, we've done a kind of exercise where we documented the data. Across Nigeria, we screened all the drivers in the parks and in the various locations across Nigeria, and we had a very comprehensive report which we have submitted to the Federal Road Safety. The first question you ask is, how many drivers are using their glasses? And the other question, the other thing is the stigma that is associated with wearing glasses. For example, you just enter the vehicle, want to enter a taxi, and the driver is wearing very thick glasses. The first thing that comes to your mind, this man is not seeing very well. So you see that most drivers, even though they have refractive error or visual impairment, they hide it because they feel like people would not want to patronize them because they know they have problems. And that is the message we need to pass on to the public, that the driver who is wearing his glasses means well, is a more responsible driver than the one that hides his visual impairment. I have experienced that myself. I had to conduct a driver's vision test for a ministry in Benue State. And when I did that, I discovered that 2 drivers were driving. One eye is completely blind. The other eye is a vision of 6/24, which is very dangerous. And sometimes they drive in the night. So this is an accident that is waiting to happen, but they hide it. I also had to conduct a driver's vision test for a company, a transport company, and most of the drivers were not willing to submit themselves for the screening because they were afraid they will be disqualified and they will lose their job. So a lot is being done to create the needed awareness. Be a responsible driver by wearing your glasses. And in that note, it calls on the Federal Road Safety and relevant agencies to partner with us to ensure that there is proper vision screening before driver's license are issued. We've been on this for quite a long time, but I think there is need for relevant laws to be enacted in that area. But we also discovered that at the state level, it's possible that through the state transport office, these things can be enforced to make sure that drivers, not just to test when you get the license, but make it a routine annual test. Because if vision problem can develop at any moment. So make it an annual or biannual routine that drivers are tested from time to time while they are doing their work. I think that is a thing that we are trying to promote, and I believe and hope that the government will see to it and this is done.
Great. And some of the other things you're promoting as well is you're hoping to get some form of a subsidy, into eye care, especially with moving more specialists into primary healthcare facilities and so forth. Now, unfortunately, the word subsidy has become somewhat of a bad word in Nigeria today. But how are you going about engaging the powers that be to get that much needed succor? Because the funding is the real issue here. How are you navigating that?
Okay, yeah. Being the president of the Nigerian Optometric Association, I'm a member of the National Eye Health Committee. Now the National Eye Health Program, which has been renamed the National Eye, Ear and Sensory Functions Program. And we have been advocating for deployment of professionals at the primary healthcare level and what we call integrating eye care into primary healthcare. Yes, it's been a very big challenge in terms of salary and payment emoluments and things, deploying experts in the rural areas and also paying them. And that's why we're coming with innovations, what we call teleoptometry. Teleoptometry is a system where we leverage on digital technology, plant satellite centers in the rural areas and coordinate it from the urban area. For example, I could have one clinic and then I could also have 4 teleoptometry centers where the community health workers could be trained to identify some of these problems, transmit them to the base hospital where the doctor could interpret and maybe do a virtual diagnosis. So that's a technology that can help us to achieve this coverage very, very speedily and effectively. So that will cut down on the need to have physical manpower, physical professionals in the various rural areas. And I think the Federal Ministry of Health through the National Eye Health Program is buying this idea. And also recently the Federal Minister of State for Health launched the outreach program. Now the outreach program is a situation where there is a kind of timely interventions in the rural areas where we have the team visit the rural areas, give some form of care, and also continue following up from time to time. In Benue State, for example, by next week we are having such a program through the help of Skipper Eye Hospitals. They have launched a new mobile clinic that contains all the equipment inside the mobile unit, the vehicle, so they can go to anywhere. On the 16th and 17th, they will be in Benue State. What we are doing is that every hospital conducts the screening, send complicated cases to the location of the outreach, and they are scanned, screened, and then very, very complex cases are attended to. So this is a form of a strategy that we can use to fulfill or satisfy this need for eye health coverage. So a lot of things are being done. The Nigerian Optometric Association, we have number, and our members are more evenly spread everywhere in Nigeria. As I'm talking to you, there are programs going on in Kano, in Jigawa, in Lagos, everywhere, you know, and some of them are more spread, reaching out to the zones and the rural areas. And that's why we present them as the frontline caregivers when it comes to eye care. And that doesn't stop the government from seeing to it, because even if we talk about it, it's not that much. 774 local governments, having 774 optometrists in each local government is not too much for the government to be.
This reminds me on another note now that of the popular parlance that in the land of the blind, a one-eyed man is the king, and that tells us about the potential danger, the potential catastrophe and tragedy of having a defective eyesight. When you look at that, fundamentally, I think the eye care is a very expensive project for many Nigerians that denies them of affordability and accessibility. So how can we achieve an affordable eye care service in Nigeria?
Thank you. First, it's already something that we can leverage on. The National Health Insurance Authority is already there. We are engaging the agency to improve on eye care, and recently they have improved on the tariff that are paid to eye care providers for rendering services. So, and the President of Nigeria, Senator Dr. Ahmed Bola Tinubu, had already approved compulsory enrollment of all employees in government agencies into the National Eye Health Insurance Program. So with that as one part, we can be able to go a long way, because if the health insurance is able to take care of the affordability aspect, because once you are enrolled, you can now walk into any accredited eye clinic and have your eyes examination and get your prescription lenses without paying any dime, and that is making it affordable. Then on our own part, we are also requesting that the government include the eye care materials, ophthalmic machines and products in the waiver that has been granted to pharmaceutical products, to make it easy for us to get, because most of the eye care consumables, lenses, they are all imported. We don't have any lens manufacturing company in Nigeria. That makes it everything depending on the dollar exchange, naira exchange rate. So when the dollar goes high, the equipment goes high. So if that can be done, it will reduce the cost of importing this equipment. On our level at the NOA, we have engaged a Dubai company that is now giving this equipment to our members at a zero interest rate and a 2 years moratorium, 2 years period to pay. So that's an initiative that is going to help a lot of them to have this diagnostic equipment, and it will also reduce the cost of the charges and the services that are rendered for the walk-in patients. I think these are ways we can help to reduce the affordability. Then accessibility, I've already mentioned what we are doing in the area of accessibility and what government can do to make eye care very, very accessible. But on the long run, a lot still needs to be done to see that eye care is rendered at a very, very affordable rate.
On a final note, as we close, all these efforts begin with you and I as individuals. What are some of the basic, easy tests we can do at home? Just, and how frequently should we be checking our eyes on a personal level? Yeah.
Yeah, the standard is to have an annual eye examination. That is the standard, to have an annual eye examination. And if you have eye conditions after diagnosis, then you may need to have the eye test or eye examinations more frequently. For children, the standard is 18 months. every 18 months they should be examined. And there are basic little things we can do at home because we have understood that 80% of eye problems are avoidable. 80% of eye conditions are avoidable. And that means they depend on behavior, they depend on what we do. For example, people are still using harmful traditional eye medications for some problems and complicate eye conditions. Then some walk into the chemist and buy some eye drops. Maybe somebody has glaucoma and you go to the chemist and you are putting in steroids. That will worsen the condition. And then, of course, we have talked about to avoid computer vision syndrome, the 20-20-20 principle, where if you watch your computer for 20 minutes, you release, exercise your eye for another 2 seconds, and of course, take a break.
Okay.
So these are some of the things we can do. Of course, eye hygiene. Wash your eyes before you wash your hand before you touch your eyes, and so many other things. Time will not permit me to give that, but we have documentation from the National Eye Health Committee that we can.
We have to wrap up. Unfortunately.
Yeah.
Thank you, Dr. Chemeziri Anderson, the president of Nigerian Optometric Association. Thank you for those insightful views that you've brought on the show. And that's all we have time for here on Daybreak. It's goodbye from me, Benga Ashuru.
That's right, I'm Vambai Mutiniri Ekweyong. Always fantastic to start the day with you. Morning show is up next. Goodbye from us.